Your morning coffee might wake you up, but what is it really doing to your heart and blood pressure? Caffeine is the most widely consumed stimulant in the world, found in coffee, tea, sodas, chocolate, and energy drinks. Millions rely on it daily for energy and focus. But its impact on the body isn't so simple. For some people, caffeine causes a noticeable spike in blood pressure, rapid heartbeat, or even palpitations. Yet studies also suggest that moderate coffee drinkers may actually have a lower risk of heart disease and longer lifespans. So is caffeine a hidden danger to your heart, or could it actually be beneficial in moderation? In this video, we'll uncover how caffeine affects your blood pressure in the short and long term, who is most sensitive, and how much is truly safe. What is caffeine? Before we dive into how caffeine affects your blood pressure and heart, let's take a closer look at what caffeine actually is and how it works in your body. A natural stimulant. Caffeine is a naturally occurring compound found in coffee beans, tea leaves, cocoa beans, and even certain nuts and plants like guarana. It's classified as a stimulant of the central nervous system, meaning it speeds up brain and body activity, helping you feel more alert and energetic. How it works in the body. Caffeine's main action is on adenosine receptors in the brain. Normally, adenosine is a chemical that makes you feel sleepy and relaxed. Caffeine blocks these receptors, reducing fatigue and increasing alertness. This also triggers the release of adrenaline and other stimulating chemicals, raising heart rate and slightly tightening blood vessels. This is why many people feel more awake, focused, and even in a better mood after a cup of coffee. Where we get it. Caffeine isn't just in coffee. Coffee, the most common source, with 70 to 150 milligrams per cup depending on strength. Tea, typically 30 to 70 milligrams per cup, along with calming compounds like L-theanine. Energy drinks often contain 80 to 200 milligrams per can, plus added stimulants. Soda, soft drinks like cola usually contain 30 to 50 milligrams per can. Chocolate. Dark chocolate has more caffeine than milk chocolate, but still much less than coffee. How the body processes it. After drinking caffeine, it enters your bloodstream quickly and reaches peak levels in about 30 to 60 minutes. The half-life, the time it takes for half the caffeine to leave your body, is about 4 to 6 hours, though this varies based on age, genetics, and health. Some people break it down fast and tolerate coffee well, while others are slow metabolizers who feel jittery even after a small amount. Caffeine is a natural stimulant that wakes you up by blocking sleep-promoting chemicals in the brain and increasing alertness. But its stimulating effects also influence the heart and blood vessels, setting the stage for how it can impact blood pressure. Caffeine and blood pressure, the short-term spike. One of the most well-documented effects of caffeine is its ability to cause a temporary rise in blood pressure. Even people with otherwise normal readings can notice this spike after drinking coffee or an energy drink. But why does this happen, and how significant is it? How caffeine raises blood pressure in the short term. Adrenaline release. By blocking adenosine receptors, caffeine increases activity in the nervous system, releasing adrenaline, the fight-or-flight hormone. Adrenaline makes the heart beat faster and causes blood vessels to tighten, which raises blood pressure. Vasoconstriction. Caffeine temporarily narrows blood vessels, making it harder for blood to flow smoothly. Kidney effects. Caffeine influences how kidneys handle sodium, which can also affect blood pressure balance. How big is the spike? For most people, caffeine raises systolic blood pressure, the top number, by 5 to 10 millimeters of mercury within 30 minutes to 2 hours of consumption. The effect is stronger in people who don't consume caffeine regularly. Regular coffee drinkers may develop tolerance, meaning the short-term spike becomes smaller over time. Why not everyone reacts the same? Genetics. Some people are fast metabolizers of caffeine, meaning they break it down quickly and experience smaller blood pressure changes. Slow metabolizers process caffeine more slowly, making the spike more pronounced. Habitual intake. Daily coffee drinkers may hardly notice a difference, while those who rarely drink it may see sharper increases. Underlying health conditions. People with hypertension or heart disease are often more sensitive to the effects. When the spike becomes a concern, For healthy adults, a short-lived increase of 5 to 10 millimeters of mercury isn't usually dangerous. But in people with already high blood pressure, even a small additional rise can increase stress on the arteries and heart. A hypertensive patient whose BP is already at 140 over 90 millimeters of mercury could see a rise to 150 over 95 millimeters of mercury after a strong cup of coffee. Over time, repeated surges may contribute to arterial stiffness and vascular damage, especially if caffeine intake is high and uncontrolled. Practical advice: if you have high blood pressure, test it at home before and 30 to 60 minutes after drinking coffee to see how your body responds. Switch to half calf or decaf if your readings jump significantly. Avoid combining caffeine with other stimulants, like energy drinks with added guarana or pre-workout supplements. Caffeine reliably causes a short-term rise in blood pressure by stimulating adrenaline and narrowing blood vessels. For most people, the spike is modest and temporary. But for individuals with hypertension or heart conditions, even a small rise can matter, making moderation and monitoring especially important. Long-term effects. Does it cause hypertension? It's clear that caffeine can cause a short-term spike in blood pressure. But what about the long run? Does your daily coffee habit actually raise your risk of developing chronic hypertension? Or is the effect only temporary? The answer, according to research, is more nuanced than you might think. Observational studies. A mixed picture. Large-scale studies have shown that people who drink coffee regularly don't necessarily have higher long-term blood pressure than those who don't. In fact, some research suggests that habitual coffee drinkers may even have slightly lower blood pressure compared to non-drinkers. This paradox is explained by tolerance. Over time, regular caffeine users adapt, and the acute blood pressure rise becomes smaller. Does coffee protect the heart? Interestingly, coffee contains more than just caffeine. It's also rich in antioxidants and polyphenols that may improve vascular health. Some studies link moderate coffee consumption, 2 to 4 cups per day, to a reduced risk of heart failure, stroke, and even death from cardiovascular disease. These benefits seem strongest in people who drink coffee consistently over many years. Heavy consumption risks. That said, too much caffeine can backfire. Drinking more than 5 to 6 cups of coffee per day has been linked to a greater risk of sustained high blood pressure in some studies. High doses can also cause chronic sleep disruption, which is itself a risk factor for hypertension and heart disease. Energy drinks, with their concentrated caffeine and added stimulants, may carry greater risks than coffee or tea. Individual sensitivity. Not everyone processes caffeine the same way. Fast metabolizers, due to certain genetic variations, clear caffeine quickly, reducing its long-term impact. Slow metabolizers may experience prolonged effects, including higher blood pressure and greater risk of heart complications with heavy use. Family history of hypertension can also influence how caffeine affects long-term risk. The role of lifestyle. Long-term outcomes also depend heavily on what else is happening in your life. If coffee replaces sugary drinks or alcohol, it may benefit overall cardiovascular health. But if coffee consumption leads to poor sleep, stress, or is combined with smoking and high salt intake, the net effect could worsen blood pressure. What experts say. Most health authorities, including the American Heart Association, conclude that moderate caffeine intake is safe for most adults and is not a major cause of hypertension. However, they emphasize individual monitoring, especially for people already diagnosed with high blood pressure. In the long term, caffeine doesn't appear to cause hypertension in most people, especially when consumed in moderation. In fact, regular coffee drinking may even offer protective benefits due to its antioxidant content. The real risks come with heavy consumption, poor sleep, or genetic sensitivity, which can magnify the effects. For most healthy adults, a few cups of coffee per day are unlikely to raise blood pressure significantly, but knowing your personal limits is key. Caffeine and the heart, beyond blood pressure. When most people think about caffeine's impact on cardiovascular health, blood pressure comes to mind first. But caffeine influences the heart in other ways too, sometimes beneficial, sometimes risky, depending on the individual and the amount consumed. Effects on heart rate. After drinking caffeine, many people notice their heart beating a little faster. This is due to adrenaline release and increased sympathetic nervous system activity. For most healthy individuals, this mild increase in heart rate is temporary and harmless. But in sensitive people, caffeine can trigger palpitations, a sensation of the heart skipping beats or pounding harder than normal. Arrhythmias and irregular heartbeats. Historically, doctors worried that caffeine could cause dangerous heart rhythm problems, especially in people with existing heart disease. However, newer studies suggest that moderate coffee consumption is not strongly linked to serious arrhythmias. Still, very high doses, particularly from energy drinks, can provoke irregular rhythms in susceptible individuals, such as those with atrial fibrillation. Impact on coronary arteries. Caffeine causes temporary narrowing of blood vessels, including the coronary arteries that supply the heart muscle. For most people, this effect is minor. But in people with coronary artery disease, caffeine-induced constriction could, in theory, reduce blood flow and contribute to chest discomfort. Caffeine and heart disease risk. The bigger picture is more surprising. Moderate coffee consumption, 2 to 4 cups daily, has been linked in multiple studies to a lower risk of heart failure, coronary heart disease, and even overall mortality. Antioxidants in coffee, such as chlorogenic acids, may reduce inflammation, improve blood vessel function, and counteract oxidative stress. Green tea, another caffeine source, is associated with improved vascular health and reduced cardiovascular risk in some populations. Caffeine and exercise. Caffeine is widely used as a performance enhancer because it increases stamina and reduces fatigue. During exercise, caffeine can raise heart rate and blood pressure temporarily, but studies show it usually does not cause harm in healthy adults. For people with hypertension or heart disease, however, combining caffeine and intense exercise may increase the risk of chest pain or palpitations. The energy drink problem. Unlike coffee or tea, energy drinks often pack very high caffeine doses combined with sugar and other stimulants like guarana or taurine. Reports of arrhythmias, chest pain, and even sudden cardiac events have been linked to excessive energy drink consumption, especially in young adults. This highlights that how you get your caffeine matters. A natural cup of coffee isn't the same as 3 cans of energy drink. Caffeine affects more than just blood pressure. It influences heart rate, rhythm, and blood vessel function. For most healthy people, moderate caffeine intake is not only safe but may even protect the heart thanks to antioxidant compounds in coffee and tea. But for those with existing heart disease, arrhythmias, or heavy energy drink use, caffeine can pose real risks. Who is most sensitive to caffeine? Not everyone reacts to caffeine in the same way. Some people can drink a double espresso at night and sleep like a baby, while others feel jittery after half a cup of tea. These differences come down to genetics, health conditions, and lifestyle factors that influence how caffeine is processed and how strongly it affects the heart and blood pressure. 1. People with hypertension. Those who already have high blood pressure are more likely to experience larger spikes after consuming caffeine. Even a rise of 5 to 10 millimeters of mercury can be significant if your blood pressure is already elevated. Doctors often recommend that people with uncontrolled hypertension limit or closely monitor caffeine intake. 2. Slow caffeine metabolizers. Genetic differences in the liver enzyme, CYP1A2, determine how quickly caffeine is broken down. Fast metabolizers clear caffeine quickly, experiencing less impact on blood pressure. Slow metabolizers feel stronger, longer-lasting effects, including higher risks of palpitations and sustained blood pressure elevation. 3. People with arrhythmias or heart disease. Individuals with atrial fibrillation, heart failure, or coronary artery disease may be more sensitive to caffeine's stimulating effects. For these groups, even moderate amounts can sometimes provoke palpitations, chest discomfort, or irregular rhythms. 4. Pregnant women. During pregnancy, caffeine is metabolized more slowly, meaning it stays in the body longer. High intake has been linked to risks such as low birth weight and miscarriage. Most guidelines suggest pregnant women keep caffeine intake below 200 milligrams per day, about 1 12-ounce cup of coffee. 5. People with anxiety or sleep disorders. Because caffeine increases adrenaline and alertness, it can worsen anxiety, panic attacks, and insomnia in sensitive individuals. Poor sleep itself raises blood pressure, so caffeine can indirectly contribute to hypertension in this group. 6. Older adults. As people age, caffeine clearance slows down, making its effects last longer. Older adults with stiff arteries or cardiovascular conditions may be more prone to blood pressure surges after caffeine. Caffeine sensitivity varies widely. Those most affected include people with hypertension, arrhythmias, pregnancy, anxiety or sleep issues, and those who are genetically slow metabolizers. For them, even modest amounts of caffeine may have a bigger impact on heart health. Knowing your body's response and adjusting your intake accordingly is the safest approach. Safe limits and practical advice. Caffeine can be a friend or foe depending on how much you consume, your health status, and how your body processes it. The key is knowing your limits and making smart choices. 1. How much is safe? Most health authorities, including the US FDA and the European Food Safety Authority, agree that up to 400 milligrams of caffeine per day is safe for most healthy adults. That equals about 4 to 5 small cups of brewed coffee, 8 to 10 cups of tea, or 2 standard energy drinks. For pregnant women, the safe limit is 200 milligrams per day. 2. Hidden sources of caffeine. Many people underestimate how much caffeine they consume because it's found in unexpected places. Energy drinks, often 80 to 200 milligrams per can, sometimes more when combined with guarana. Pre-workout supplements can contain 200 to 400 milligrams in a single scoop. Soda, 30 to 50 milligrams per can. Chocolate, especially dark chocolate, which contains 20 to 40 milligrams per serving. Being mindful of these hidden sources prevents unintentional overconsumption. 3. Practical tips for people with hypertension. Test yourself. Check your blood pressure before and 30 to 60 minutes after a caffeinated drink to see how your body responds. If readings jump by more than 5 to 10 millimeters of mercury, consider cutting back or switching to decaf. Avoid pairing caffeine with high-sodium foods, which can amplify blood pressure spikes. 4th, best times to consume caffeine. Drink caffeine earlier in the day to prevent sleep disruption. Poor sleep worsens blood pressure and heart health. Avoid caffeine 6 to 8 hours before bedtime. For athletes, timing caffeine about 30 to 60 minutes before exercise can improve performance. But those with hypertension or heart disease should consult a doctor first. 5. Alternatives for the sensitive. Decaf coffee contains only a small fraction of caffeine, but retains many antioxidants. Green tea, lower caffeine content plus calming compounds like L-theanine. Herbal teas, naturally caffeine-free options such as chamomile or hibiscus, which may even help lower blood pressure. 6. When to seek medical advice. See your doctor if you experience frequent palpitations, chest pain, or dizziness after caffeine. Your blood pressure consistently spikes significantly after coffee or energy drinks. You rely heavily on caffeine to get through the day. This may signal underlying fatigue, poor sleep, or stress. For most healthy adults, up to 400 milligrams of caffeine per day is safe. But sensitivity varies, and people with hypertension, arrhythmias, or pregnancy need to be extra cautious. Knowing where caffeine hides, monitoring your response, and timing intake wisely helps you enjoy the benefits without risking your heart or blood pressure. Conclusion. Caffeine is powerful, and its effects on your heart and blood pressure aren't as simple as good or bad. In the short term, caffeine can cause a noticeable spike in blood pressure by stimulating adrenaline and narrowing blood vessels. For most people, that rise is temporary and not dangerous. But for those with hypertension, heart disease, or caffeine sensitivity, even a modest jump can matter. In the long run, the story is more balanced. Moderate coffee and tea consumption, around 2 to 4 cups daily, doesn't appear to cause chronic hypertension. In fact, research suggests it may even lower the risk of heart failure, stroke, and death from cardiovascular disease thanks to the antioxidants and other beneficial compounds in these drinks. The key lies in moderation, timing, and knowing your personal limits. So what should you do? If you're healthy and enjoy coffee or tea, you don't need to give it up. Stick to safe limits, avoid energy drink overload, and watch how your body responds. But if you have high blood pressure or heart issues, monitor carefully and discuss caffeine with your doctor. If this video gave you clarity about caffeine's real impact, hit the like button so more people can learn the truth. Don't forget to subscribe for more doctor-approved insights into blood pressure and heart health. And if you know someone who's worried about their daily coffee habit, share this video. It might just help them find balance. Thank you for watching, and remember, caffeine can boost your day, but your health always comes first.